The National Community Oncology Dispensing Association, in collaboration with healthcare providers, payers, and employer groups, has set the standard for oncology practices to take a patient-centered approach by outlining best practices for the provisions of oral chemotherapy. Beyond the First Fill shares an effective model for an oncology practice to become a medically integrated pharmacy and as the benchmark for positive patient care outcomes at the practice level. Before going beyond the First Fill, patients cared for by their provider pick up their cancer medication. This can be done in the doctor's office or cancer centers that have medically integrated pharmacy services, but often it can only be filled once here, if at all. Mail-order pharmacy companies make deals with payers and employer groups who help decide where patients will receive their medications. This is a huge obstacle for better patient care. Mail-order companies ship across the country, causing delays and oversights on the patient's daily care. Mail-order companies lack the personal touch for proper patient management, especially in cancer care. This problem leaves the crucially medically integrated pharmacy team out of the loop. Patients may even refuse to take the prescribed treatment because side effects aren't properly managed by these mail-order companies. This results in patient dissatisfaction, wasted money, and bad outcomes. After going beyond the First Fill. With adopting NCODA's quality standards to go beyond the First Fill, healthcare providers are able to utilize easily accessible information in the patient's electronic medical records, helping prescribers make more informed decisions. The patient now receives their more accurately tracked prescriptions through the medically integrated pharmacy service within the doctor's office, which helps provide a stronger continuity of care. The Cancer Center is able to work closely with the payer/employer group to ensure cost savings, enhanced patient satisfaction, and better health outcomes. Instead of mail order, the Cancer Center is able to manage unnecessary drugs from being delivered, and the patient care team is able to better communicate with the patient. This leads to reduced waste, improved cost savings, and better patient care. Take action and join NCODA's growing network of medically integrated pharmacy practices focused on changing the landscape of patient care at www.ncoda.org.